Megan Fox spoke in a recent interview about her struggles with body image and the challenges of living under the microscope of Hollywood. I have body dysmorphia. I don't ever see myself the way other people see me. There's never a point in my life where I loved my body. Fox, 37, said in a video interview for the Sports Illustrated Swimsuit 2023 issue. The actress has spoken about having body dysmorphia and other mental health issues in the past. We're going to review body dysmorphia, discuss what it is, and how it can be managed and treated. Body dysmorphic disorder, commonly referred to as body dysmorphia, is a psychological condition that is characterized by an individual's persistent preoccupation with perceived flaws in their appearance, which are often minor or not observable to others. BDD is not simply about being unhappy with one's appearance. It's about an obsessive focus on perceived defects or flaws which are usually minimal or even imagined. The disorder often involves body parts such as the skin, hair, or nose, but any part of the body can be the subject of distress. For the affected individual, the obsession may cause significant distress, impact daily functioning, and may lead to the avoidance of social situations. People with body dysmorphia tend to compare their looks with others, check their appearance in the mirror obsessively, or avoid mirrors altogether. They may also seek cosmetic procedures or constantly change their clothes to try to fix their perceived flaws, but these actions often only provide temporary relief. How is body dysmorphia diagnosed? BDD is typically diagnosed by a mental health professional such as a psychiatrist or psychologist through a clinical interview. During this process, the professional evaluates the patient's symptoms, mental health history, and the impact of the symptoms on the patient's daily life. Diagnostic criteria for BDD according to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, include 1. Preoccupation with one or more perceived defects or flaws in physical appearance that are not observable or appear slight to others. 2. At some point during the course of the disorder, the individual has performed repetitive behaviors or mental acts in response to the appearance concerns. 3. The preoccupation causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. 4. The appearance preoccupation is not better explained by concerns with body fat or weight in an individual whose symptoms meet diagnostic criteria for an eating disorder. Let's discuss the incidence and prevalence. Body dysmorphia is more common than one might think. It is estimated to affect about 1 in 50 people, roughly equivalent to about 2% of the population, and affects both men and women almost equally. The onset of BDD tends to occur in adolescence, a time when people are generally most sensitive about their appearance. However, the disorder can go unrecognized for many years, as individuals suffering from BDD often feel shame or embarrassment about their preoccupations, making them less likely to seek help. What are the risks associated with body dysmorphia? There are several potential risks associated with BDD. It often co-occurs with other psychiatric disorders, such as major depressive disorder, social anxiety disorder, obsessive-compulsive disorder, and eating disorders. Moreover, people with BDD are at a high risk for suicide. In terms of social functioning, the disorder can lead to self-imposed social isolation due to shame about one's appearance or fear of judgment from others. This can negatively affect relationships, academic performance, and job functioning. Additionally, the repeated seeking of cosmetic procedures without satisfaction can lead to financial difficulties and potential physical harm from unnecessary surgeries. How is body dysmorphia treated? Body dysmorphia is a treatable condition, and help is available. Cognitive behavioral therapy, a type of psychotherapy, is considered to be the most effective treatment. It involves helping the individual recognize irrational thoughts and change behaviors related to their body dissatisfaction. CBT for BDD typically involves elements like cognitive restructuring, exposure to avoided situations, and response prevention to the compulsive behaviors. If you are struggling with your self-image or confidence, you should seek out the help of a licensed mental health provider. If you're a teenager, you should discuss your feelings with your parents, even if it seems scary to do so. If you have any thoughts of harming yourself, you should reach out to the National Suicide Prevention Hotline by dialing 988. Thank you for watching, and make sure to subscribe for more health information.